Have you ever felt unusually tired, lost weight without trying, or noticed that your digestion has suddenly changed, then blamed it on stress, aging, or something you ate? What if these seemingly ordinary changes were actually signals your body was sending you months before a serious problem became obvious? Pancreatic cancer can be difficult to detect because early symptoms may be mild, vague, or completely absent. Many people dismiss changes in their appetite, digestion, energy, or weight until several warning signs appear together. But remember, these symptoms can have many causes, and experiencing one does not mean you have cancer. The key is recognizing symptoms that are persistent, unexplained, or worsening. Could recurring pain in your upper abdomen or back be connected to your pancreas? Why might your urine become darker while your stools turn unusually pale? What could unexplained weight loss, loss of appetite, or suddenly difficult to control blood sugar be telling you? And why do some warning signs become more noticeable after eating? In this video, you will discover the important warning signs that may appear before pancreatic cancer is diagnosed, how they can affect digestion, appetite, weight, skin, blood sugar, and energy, and when it is important to speak with a healthcare professional. You will also learn why noticing a pattern is more important than panicking over one isolated symptom. This video is for education and awareness only. It cannot diagnose cancer. If you experience jaundice, persistent abdominal or back pain, unexplained weight loss, or a sudden health change, seek medical advice promptly. Before we get into it, can you do us a quick favor? Like this video and comment 1 if you're ready for what's coming. Alright, let's get started. Hidden deep in the upper abdomen, behind the stomach, the pancreas can develop problems without causing obvious pain at first. Its location makes early changes difficult to notice, and routine screening is not generally recommended for average-risk adults without symptoms. The pancreas has two vital responsibilities. It produces enzymes that help digest food, and it releases hormones such as insulin and glucagon to regulate blood sugar. When this organ is affected, the warning signs may appear elsewhere: persistent indigestion, upper abdominal or back pain, unexplained weight loss, unusual fatigue, changes in urine or stool, yellowing of the skin, or unexpected blood sugar changes. The danger is that these symptoms can easily be mistaken for stress, aging, poor sleep, or a simple stomach problem. One symptom does not automatically mean cancer, but persistent or unexplained changes deserve medical attention. Recognizing patterns can help you act sooner instead of ignoring your body's signals. Now, let's see what your body may be trying to tell you. Sign number 12. Feeling full after just a few bites. Do you become full after eating only a small amount, even when you started the meal feeling hungry? This is called early satiety. Pancreatic cancer may sometimes contribute to this sensation if a tumor affects or presses on nearby digestive structures, including the stomach or duodenum. It can also occur alongside reduced appetite, nausea, bloating, or unintentional weight loss. However, feeling full quickly is common and can result from many other conditions, such as indigestion, reflux, ulcers, constipation, or delayed stomach emptying. It does not mean you have pancreatic cancer. But if early satiety continues for several weeks, worsens, or occurs with unexplained weight loss, persistent abdominal pain, vomiting, or yellowing of the skin or eyes, arrange a medical evaluation promptly. Sign number 11. Persistent indigestion. Indigestion after meals can feel like burning, pressure, bloating, or discomfort beneath the breastbone. Most cases are caused by reflux, ulcers, food intolerance, or other common digestive conditions. However, persistent indigestion that continues despite treatment, especially when accompanied by nausea, reduced appetite, early fullness, greasy stools, or unexplained weight loss, deserves medical evaluation. The pancreas produces enzymes that help digest fats, proteins, and carbohydrates. Pancreatic cancer can sometimes interfere with enzyme production or block the pancreatic duct, disrupting digestion and causing symptoms such as gas, bloating, cramping, or abnormal stools. A tumor may also press on the stomach or duodenum, contributing to nausea and difficulty eating. This does not mean ordinary heartburn is a sign of cancer, but if indigestion becomes frequent, changes noticeably, or occurs with jaundice, persistent pain, vomiting, or weight loss, do not rely only on antacids. Speak with a healthcare professional. Sign number 10. Crushing fatigue. This is more than feeling tired after a busy week. It is persistent exhaustion that does not improve with adequate sleep or rest and begins to interfere with normal activities. Fatigue can occur when cancer causes inflammation, poor nutrition, weight loss, digestive problems, or anemia. The exact biological mechanisms can vary, so it is not accurate to assume that a tumor is simply stealing all your energy. Research using medical records in England found that fatigue was among several symptoms associated with pancreatic cancer, and some patients experienced it months before diagnosis. However, fatigue is extremely common and is more often linked to conditions such as anemia, thyroid disorders, infections, depression, diabetes, medication effects, or sleep problems. If severe tiredness persists, worsens, or appears with unexplained weight loss, abdominal pain, jaundice, appetite loss, or changes in digestion, schedule a medical evaluation. Persistent fatigue should be investigated, not automatically attributed to aging or stress. Sign number 9. Loss of appetite or sudden food aversion. A noticeable loss of appetite can mean that familiar foods no longer appeal to you, meals become difficult to finish, or nausea appears when you smell or taste certain foods. In some cancers, inflammatory signals such as interleukin-6 and tumor necrosis factor alpha may affect the brain pathways that regulate hunger and contribute to reduced food intake. Cancer-related inflammation can also be associated with altered taste and unintended weight loss. However, appetite loss is not specific to pancreatic cancer. Infections, medication side effects, depression, dental problems, digestive disorders, and other illnesses can produce similar changes. Do not assume it is simply a normal part of aging. If reduced appetite continues, causes unintentional weight loss, or occurs with persistent nausea, abdominal pain, jaundice, dark urine, or changes in bowel movements, arrange a medical assessment. Early evaluation can help identify the real cause and ensure that nutritional problems are addressed. Sign number 8. Unexplained weight loss. Losing weight without changing your diet or exercise routine deserves attention, especially when the loss is significant. Pancreatic cancer may contribute to weight loss through reduced appetite, impaired digestion caused by insufficient pancreatic enzymes, and cancer-associated cachexia, a condition involving inflammation and the breakdown of muscle and fat tissue. Research using medical records in England found that weight loss could begin about a year before pancreatic cancer diagnosis, with changes sometimes appearing even earlier. The combination of weight loss and rising blood sugar was particularly important in that study, but these findings do not mean that weight loss alone confirms cancer. Clinically, losing more than 5% of your usual body weight within 6 to 12 months without trying is considered significant and should be evaluated. Other causes include thyroid disease, diabetes, infections, digestive disorders, depression, and medication effects. If weight loss occurs with abdominal pain, jaundice, appetite loss, or new diabetes, contact a healthcare professional promptly. Sign number 7. New-onset diabetes after age 50. Developing diabetes after age 50 can sometimes be an early clue that the pancreas is not functioning normally. Studies estimate that about 0.8% to 1% of people with new-onset diabetes in this age group are diagnosed with pancreatic cancer within 3 years, roughly 1 in 100. Their relative risk may be 6 to 8 times higher than average, although the absolute risk remains low. Pancreatic tumors may disrupt insulin regulation, but most new diabetes cases are not caused by cancer. This possibility becomes more concerning when diabetes appears suddenly, occurs alongside unexplained weight loss, abdominal or back pain, or proves unexpectedly difficult to control. Do not panic or request unnecessary tests based on diabetes alone. Instead, tell your doctor about the timing of the diagnosis, changes in weight, family history, and other symptoms. Your healthcare professional can decide whether additional evaluation is appropriate. PanCan's Early Detection Initiative is studying adults over 50 with newly diagnosed diabetes to improve early detection strategies. Sign number 6. Deep pain that spreads to the back. Pain linked to pancreatic cancer may begin in the upper abdomen and travel toward the middle back. Because the pancreas lies close to major nerve networks, including the celiac plexus, a tumor can irritate or compress these nerves and create a deep, dull, persistent ache rather than ordinary muscle soreness. For some people, the discomfort becomes worse after eating or while lying flat, and may improve when sitting forward. It can occur with abdominal pain, weight loss, nausea, or digestive changes. Research on symptoms before diagnosis has identified abdominal and back pain among the most frequently reported complaints, sometimes lasting for months before pancreatic cancer is confirmed. Still, most back pain is caused by muscles, joints, discs, or other common conditions. Do not assume cancer based on pain alone. Seek medical advice if the pain is new, persistent, unexplained, progressively worsening, or accompanied by jaundice, vomiting, appetite loss, or unintentional weight loss. Sign number 5. Pale, greasy, or floating stools. Pay attention to persistent changes in your bowel movements. Stools that become pale, clay-colored, oily, foul-smelling, unusually large, or difficult to flush may indicate that bile or pancreatic digestive enzymes are not reaching the intestine properly. A tumor near the pancreas can obstruct the bile duct, reducing bile flow and causing pale stools, often with dark urine or yellowing of the skin and eyes. Insufficient pancreatic lipase can also prevent proper fat digestion. This may lead to steatorrhea, in which undigested fat passes into the stool, making it float, appear greasy, or leave an oily film. These changes can also result from gallstones, liver disease, celiac disease, chronic pancreatitis, or certain medicines. If they persist, recur after fatty meals, or occur with weight loss, abdominal pain, dark urine, or jaundice, contact a healthcare professional promptly. Do not try to diagnose the cause by appearance alone. Sign number 4. Persistent nausea after meals. Feeling queasy after eating can occur for many reasons, including reflux, food intolerance, infections, medication effects, gallbladder disease, or delayed stomach emptying. In pancreatic cancer, nausea may develop when a tumor affects nearby digestive structures or obstructs the duodenum, the first part of the small intestine. This can slow the movement of food and, in some cases, cause vomiting containing undigested food. Nausea alone is not specific enough to indicate cancer. Pay closer attention when it persists, repeatedly follows meals, reduces your food intake, or occurs with early fullness, abdominal pain, weight loss, jaundice, or changes in bowel movements. Persistent vomiting can lead to dehydration and may signal a blockage requiring urgent medical attention. If antacids do not help and symptoms continue, arrange a medical evaluation rather than treating the discomfort indefinitely at home. Sign number 3. Yellowing of the skin or eyes. Jaundice is a yellow discoloration of the whites of the eyes or skin caused by excess bilirubin in the bloodstream. When a tumor develops in the head of the pancreas, it may compress or block the bile duct, preventing bile from flowing normally into the intestine. Bilirubin then builds up, often causing dark urine, pale stools, and widespread itching. Jaundice can occur in many pancreatic cancer cases, particularly when the tumor is located near the bile duct, but it is not proof of cancer. Gallstones, hepatitis, liver disease, and medication-related liver injury can produce similar symptoms. Still, new yellowing in an adult should never be ignored. Contact a healthcare professional promptly, especially if jaundice appears with abdominal pain, fever, vomiting, unexplained weight loss, dark urine, or pale stools. Medical evaluation may include blood tests and imaging to identify the cause and determine whether the bile duct is blocked. Sign number 2. Unexplained blood clots. Pancreatic cancer can increase the body's tendency to form blood clots, a condition associated with Trousseau syndrome. Tumor-related inflammation and changes in clotting proteins may activate the coagulation system, sometimes causing a clot without an obvious trigger. However, most unexplained clots are not caused by pancreatic cancer and may result from medications, inherited conditions, infections, recent travel, surgery, or reduced mobility. A deep vein thrombosis may cause swelling, warmth, redness, or aching in one leg, usually the calf or thigh. If part of the clot travels to the lungs, it can cause a pulmonary embolism, with sudden breathlessness, chest pain, coughing blood, dizziness, or fainting. These symptoms require emergency medical care. Anyone with a new or recurrent clot should receive proper medical evaluation. Tell your doctor if there is no clear explanation, particularly when the clot occurs alongside unexplained weight loss, abdominal pain, jaundice, or persistent digestive changes. Sign number 1. Severe, unexplained itching. Intense itching across the body, especially without a visible rash and worse at night, can sometimes signal a problem with bile flow. A tumor near the head of the pancreas may obstruct the bile duct, causing cholestasis. This allows bile-related substances to accumulate in the bloodstream and can trigger widespread pruritus. The itching may appear with yellow skin or eyes, dark urine, pale stools, or unusual fatigue. However, itching does not automatically mean pancreatic cancer. Liver disease, gallstones, medication reactions, kidney problems, allergies, and other conditions can cause similar symptoms. In fact, the exact mechanism of cholestatic itching is complex and is not explained simply by bile salts depositing under the skin. If severe itching persists for more than 2 weeks, disrupts sleep, or occurs with jaundice, dark urine, pale stools, abdominal pain, or weight loss, arrange medical evaluation promptly. Blood tests and imaging can help identify the underlying cause. Yellowing of the skin or eyes is not a symptom to ignore. It may result from a blocked bile duct linked to pancreatic cancer, but gallstones, hepatitis, liver disease, and medication reactions can cause it as well. Because jaundice may indicate a serious problem involving the liver, gallbladder, or pancreas, adults who notice it should contact a healthcare professional promptly. Pay attention to associated signs such as dark urine, pale stools, persistent itching, abdominal pain, vomiting, fever, or unexplained weight loss. A clinician may use blood tests and imaging to determine whether bile flow is blocked and identify the underlying cause. If this video helped you understand the warning signs, share it with someone you care about. Subscribe for more evidence-based health information. Turn on notifications, and comment below which symptom surprised you the most. Remember, awareness is not a diagnosis, but persistent changes deserve professional attention.